I want to get started with two little stories of two people. They're not their real names, but they're real people and real stories. Haley Ann, my wife and I met her a little over a year ago and at our church. And somehow we found out that she had some back pain, and I'm a nerd about this stuff. So I was like, hey, I'd love to see if I could help you. And we had them over for dinner, and her and her husband. And I was like, hey, can I take a look at your back pain? She started telling me the story, and she's had back pain for 10 years. And she used to work in the medical field, not like super medically, but like with the notes and things like that, more on like the documentation side of things. And so, but she had access to pain management doctors and people with low back pain, or people that saw low back pain, and they took x-rays, gave her some advice. She didn't get better. And she saw 2 different chiropractors over an extended period of time. And she would have temporary relief for a couple hours or like a day, and then it would come back over 10 years. She even saw a physical therapist, and they gave her a cookie cutter approach, and she decided it wasn't for her. And then she's in my living room. And so I looked at her for an hour, tried to figure out what was going on. I figured out that she couldn't rotate and side bend this way, and that's what brought on her pain. I did a manipulation, probably a very similar manipulation to the chiropractors that she had seen, but they didn't get the spot. And since then, she hasn't had pain, and it's almost been a year. And I did the one manipulation, taught her an exercise for a couple weeks to do, and then it's never come back. And then there's a girl named Mary that I'm currently seeing. And if you saw the last Facebook ad, Facebook little thing I made, that text message was from her, and I'm currently seeing her. And she came to me. She's had back pain since 2020, especially when she was squatting and deadlifting. She's super active. She likes to run, works out all the time, but she's had this back pain from like a disc injury. And she did a year, I can't remember which one it was. It was like a year and a half of chiropractic care. And then the other one, a year and a half, was from spinal decompression therapy. And both of them were 3 times a week for a couple weeks, 2 times a week for several months, and then 1 time a month for several months. So thousands and thousands of dollars, and lots of time. And when I was talking to her on the phone before I saw her in person, I was like, man, that's a lot of time. I was like, I don't know for sure if I can help you until I see you in person, but I bet I could do it faster than that. And I saw her in person, and she bought a 5 package with me. And within 3 weeks, I saw her once a week for 3 weeks. And the third time she came in, she had 0 out of 10 pain. And she was having 2 out of 10 pain just standing still. And during squatting and deadlifting, it was like a 6 or 7 out of 10 with like a 15-pound kettlebell. And after I saw her that third time, she hit a new PR, and she texted me. She's like, 10-pound increase in my 5-rep deadlift. And then she's like, whoops, make that 20. Thank you. So I say those stories, because they make me feel good. And but also it's like I'm super passionate about helping people with lower back pain, and I think I'm pretty good at it. So that's why you're here. And my job today is to make you feel as though you made the right decision for coming here. And if I don't answer your question or feel like I don't help you out, please talk to me at the end, because then it can be a little bit more specific. Because the thing that it's not like I had this magic bullet. It was that every person is unique and individual, and other people were just missing the mark on what they specifically needed. So anyways, a quick note about imaging. One thing I hear all the time is like x-rays and MRIs. It's like they're always just like, I have degenerative disc disease, I have bulging discs, I have a degenerated spine, I have spondylolisthesis or retrolithiasis, and it points out all these things. And so if I were to go and get an MRI of my back right now, it would point out these things, and I wouldn't care at all. Because I don't care what the MRI sees, I care about how I function. And so, because it's going to list, there's like the perfect body in the textbooks, and then there's your body, and it's never the same. Because like little things happen, but it doesn't really matter if there's like this one thing that points out, like if your disc pokes out a little bit, Sometimes it does, but if you have like a list of 10 things wrong with you, there's likely only one of those things that's causing your pain. And sometimes there's an image of a perfect spine and they have back pain. So like their spine is perfect and then they have low back pain. So what's causing the back pain? It's not an image, it's things that are likely not moving well above or below it, or a lack of stability in your core that's not helping the low back. And so like I've even seen it to where a neck issue, they can't fully rotate their neck. And so then anytime they go and talk to Kat, they're not doing this, they're doing this. And all of those things that are adding up over and over and over again, day after day after day, they add up, and then you get your low back pain, or even a foot issue every step you take. Today we're going to focus at the hips and the mid back, and then a little bit in the low back as well. But like, even if you have a low back injuries, if we address the hip and the mid back, it's gonna, above and below it, it's gonna help the low back feel better. So that's the goal for today. In general, there's 3 categories that every PT kind of points people in the direction in for a very general approach. People's low back pain either feels better when you flex the back or round it, it feels better when you extend it, or it feels better when you stabilize it. Most of the time, there's some sort of injury that happens, way back when. And with that injury, now the back has a tendency to move too much. And anytime a joint moves too much, it sends an abnormal input to your brain. And that's where you get your pain. It's like, hey, there's something new, something weird going on here. And you get like either a dull pain, or sometimes it's like, whoa, and then everything locks up. And then that's when you're like, it just needs like a little reset with like a manipulation or some gentle exercises. But really the thing, it's not the locking up that's the problem. It's, hey, we need to stabilize this every day so that it doesn't do that, and then lock down, if that makes sense. So most of the time we need flexion-based exercises and stability, so rounding and stability, or extension and stability. And that's the thing. If you've had back pain for more than a month, you need to work on stability, because that's the main thing, that's the problem. How does that sound? Everyone tracking with me? I feel like I'm like talking a lot. But that's basically it for like the talking. And then I want to get moving. But I wanted to, we'll just skip I was going to do like a little demonstration, but we're not going to do it. So I was going to have Matt as the low back, lifting up a bar. And then I was going to have 2 people on either side help him. And the whole idea is like, he could probably lift so much weight by himself, but then if 2 other people are helping him, then he's going to be able to do a lot more, obviously. And so the idea is if we can get the hips, the low back, and the mid back all working well, then you're going to have a 10 times easier life. So that's the idea. So I want to show us a couple tests, and then do some treatment based on the findings of those tests. How's that sound? Pretty good? Cool. Amy, can you come over here? And this is Amy. Yeah. Yeah. Can you lay on your back? Mm-hmm. And so we're going to look at how well the hip can open and how well the hip can close. And then if anyone, I'm assuming at least somebody in here is going to have a problem with that, then I'll show you how to open up the hip or stretch it out. So this is Amy. And this is a test called the Faber test. You just kind of let the leg hang, and you can kind of guesstimate of how high the knee is above the table. And so if her hip was really restricted, it would look like that, or, different than the other side. And so then you go like this, and that's about even. Do this side again. So that side has a hard time opening, because this is like just a little more than a fist. And then this side, I didn't even know this was going to happen. But that side is like that. So that's one test. And we can like share the table or like do a yoga mat and then partner up is what I'm picturing. But we got to work on Amy's left hip with opening. And then, which is funny because I think I was working on this hip with the other way before. Anyways, and then this is a test to see how much motion, it's called internal rotation, how much the knee wants to turn inwards, if that makes sense. But that's how you test it. You just kind of grab the ankle and see how much motion. Don't crank on it. But you just kind of see how far it wants to go. And then you compare it to the other side. But rotation is like the same idea as like the neck thing that I was telling you about. Like if you can't do this and rotate through your hips and your whole body really, then your low back is making up for it. Moving too much causes pain. So this side, it's like 25-ish degrees. It's like one of those useless skills you get as a PT. But that side's a little bit more. Kind of hard to see, but that's like 30. And then this side is a little bit less. Yeah, if I don't fight it so much. So this side needs to close, needs to get better at doing this motion. And then that side needs to get better at opening, which is kind of interesting. And actually, she just had low back pain like 2 weeks ago. And that was probably part of it. We need to work on those hips. So let's pair up and grab a yoga mat. Somebody can use this table if they're comfortable using it after my wife just laid on it. And then I'll show you guys how to treat it. How's that sound? All right, cool.
6 months for it, they got a little bit better. But I mean, they tried, manipulation, scraping, and stretching, and exercises. Again, it gets a little bit better, but and I have no idea what caused it.
Yeah. Huh. I'll take a look at it at the end if you want. But anyways, you guys good? All right, cool. Let's do, can I show everyone yours?
Sure.
And then we'll do like before and after of, and hopefully it's different. But can you lay on your back?
Yeah.
So what I told Matt was how much, or what is a positive test? And it really is like side to side, unless you're Jerry. Because both of his hips don't want to open at all. That's how high his, this one's way worse actually. Yeah, I mean, that's a kneecap.
But it also has a higher starting point.
That's true. That's
put
true.
My leg down flat.
That tight, and they can't even get close to like how Amy's were, then need to work on both of them, I would say. So I'll show you how I like to do that. Can you sit up? And then, have you guys ever seen like Squat University's things? Ever heard about him?
I've heard of Squat University.
Oh, okay, cool. Yeah, I really like his stuff. So if you ever see this is one of his things that I really like. I'm just gonna grab a little weight. And then, here you go, Jerry. And the other thing with Jerry too, if you don't mind me picking on you,
That's fine.
when he's laying down, he has a hard time resting his neck on the ground, which makes me want to test and see how mobile his mid back is, which is where we're gonna go. But if his
Spoiler alert, it's not.
yeah. So like if his hips don't want to open and his mid back doesn't want to at least extend, he's probably more limited in rotation in one way, then he's screwed. No, but his low back is gonna have a problem, even if he has a low back injury, and that's where the problem is. If his hips were moving golden and his mid back was moving golden, he probably would have a lot less problems if you didn't even address the back. So we're gonna do one of these. You're gonna grab onto the weight, and then I want you to shift over and stretch your groin. Not really into pain or low back pain or anything, just a groin stretch. Hold for 5 seconds and then come out of it. We're gonna do 5 times on both sides. Do you think it's gonna bother your knee being on here?
No, it's fine. It's fine being bent.
Sweet.
So,
Yep.
this I can.
Yep. Just a little bit, and then point your knee or your foot that way. Yeah. Try and track your knee over your toes. Yeah. Hold for 5 seconds. Feel groin stretch. Hold for 5. Let's Give Jerry a round of applause. Let's go, Jerry. Yeah. Hold for 5 seconds. Good. Yeah. So a lot of times what I see, sorry, I don't want to pick on him too much, but like right where his spine wants to bend forward, a lot of times there's like a lesion. It's not a bad thing. It's just a name of a dysfunction in his mid-back. And then it's trying to protect that joint from extending. And so I could guess where it is without doing any tests, but it's like right around there is tight. And so he could try working on his posture all day long and be like, oh, chest up, shoulders back. But unless you like address that joint and get it, I mean, I would probably just manipulate it. It kind of just does like a factory reset for a little bit. And then you work on the exercises and then you work on your posture. It's way different than doing just exercise. So we'll look at that in a minute. Can you do the other side too?
We'll see.
Yeah, nice. Drive that knee out. Yeah, good.
That feels tight.
Fix this. Yeah, good.
So you do this for an assessment?
The other thing is the assessment. This would be like a treatment.
Okay.
So this is like, you have tight hips, you can't open that hip up. Now let's work on opening it up. Ideally, it would be stretch it, and then after we gain that mobility, then you want to strengthen within that mobility so it maintains. And then this could be part of a workout as well, or a warm-up before you do like squats, deadlifts, other things. So then that way, when he is trying to move and do his normal workout or even everyday stuff, then it's free and it's not going to aggravate his low back. So give that a try, and then can you lay back down? Boom, 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 boom. You're thinking about your head now? So now straighten out this knee, and then we'll do one of these and see how far it can drop. Ugh. Relax. So not any better at all. So, I mean, sometimes, let's see how this side is. Oops, sorry. That side might be a little bit. Yeah, that one's better. Sometimes what I see too is that people with low back problems or pain, even if it's not currently symptomatic, your body's protecting your body. And it's just like, I'm not going to let this hip go. Like, I'm going to hang on. And so even just if addressing the back, then the hip will kind of relax a little bit more, is a theory for your right hip. But it worked pretty well for your left hip, actually. So that's one that we could do. Was anyone more limited with the other test, this one? Besides Amy? Matt was? All right, you can stand up. Let's go test Matt's real quick, and then I'll show you how to address that. And then if there's time at the end, I think there's going to be, then I want to do like a little treatment, maybe like test a squat real quick, and then we'll see how much better we do after everyone kind of does their thing. But I just kind of want to show everybody everything, and then you can do the stuff on your own at home. How's that sound? Pretty good? Yeah. Cool. So Matt, come on over here, and then I'll show you the before and after. Can you lay on your back?
I wore my festive socks for you.
I love it. Those are nice. Is this his positive side? Or the...
Both. Yeah, this one's not good.
Okay. Relax. Not good. What?
Kat said it's not good.
Oh, yeah. This one? This one's tight. I think it's the left one. But his left one goes like 10 degrees. And then his right one goes a bit more. Sorry, Kat. So that's like normal, 30. 30 is like normal, but it also just depends on your hips. Hips are pretty based on the factory settings. So that left one actually doesn't want to open. Sometimes it's joint related, sometimes it's muscular, like the piriformis thing. I wouldn't be surprised if you have this thing called a maltracking hip. And I've actually looked at Matt's hips before, because test this before, like hold your leg there. Don't let me move you. Hold. Pretty strong. And then I want to test this one. Hold there. Don't let me move you. I'm going to pull. And it's a lot harder. And then keep your leg relaxed. Yeah. So anyways, just by playing with it now, it actually already wants to go more. I think that's just more him like relaxing a little bit more. But I think that tells me it's probably more muscular. There is this one, like little technique I can do. Remember that one where I kind of slap your hip?
Yep.
Well, anyways, because I feel like Matt's is more muscular. There is something else I can do with it that where like you kind of like, it's kind of goofy. You kind of like slap the side of the hip, but it kind of shuts off the muscle and then you have to retrain it. But anyone else have limited this motion? Yeah? Are you comfortable hopping up here? Nice. Sorry, Matt.
Oh, you're good.
Oh. The right hip, right? Yeah. Gotta get it right. Gotta get it right in front of the crowd. Yeah, this one's a lot different. So it's about half, I'd say, for how far this one wants to close down. You don't have any pain with that, right? So we're going to, I'll show you how to kind of work on stretching that joint with a band over here. So come on over here. So I'm gonna send you guys the form, like how to, so it's all in one place, so you don't have to remember everything. So you're welcome. But we're gonna do one of these, and then it was your right hip, correct? So you're gonna slide in here, get it as high into your groin as possible, and then stretch this sucker out. So the idea is that the hip joint is kind of like this, and it kind of gives it some space. So now you're working on the joint capsule and not the muscles. And then you pull the hip in, and so you pull the knee in, and then you work on just hinging forward and getting a little stretch. So the band right now is trying to creep up on me. I want it to be just off of like my side of my hip bone and right on my thigh. So just kind of pull it in, try and relax the leg, and then stretch forward. I'm not tight, so it's not a big deal. You want to try that?
Yep.
Sweet. Yeah. Got it?
I can go as far as you did.
Yeah. There you go. And then give your knee some support so that you don't have to use your muscles.
Okay.
Bring the knee in and then hinge forward from your hips. Feel a little stretch.
A little bit.
Hang out there for, we'll just do the same thing, 5 seconds. Come out of it. And then go back down for 5 seconds. Try and go a little further. What's up, Brian? Good. And then, hopefully, we test the hip and it's different. I mean, if not.
2 for 2.
Yeah. So the whole idea is when you bring the hip into what's called internal rotation, bringing the foot like this, the joint moves like this, and it stretches the back part of the joint capsule itself. So combining internal rotation with hinging forward, it just stretches it out. And if that can move better, it's going to make your back feel better. So that's probably good enough. Feel a little looser by the end.
A little bit.
Okay. So we'll retest it, and then I'll have Amy come back up here. Perfect. Yay. Yeah, so that's a normal what we want. Yeah. Let's go. Yeah, awesome. So that would be like, that could be a great warm up of like, oh, let's make sure everything's moving right before you exercise. And specifically like when you're doing a squat, I should have had you do a squat too, but like her right hip didn't want to close. And a lot of times what you'd see is it kind of drop like this, like her pelvis would tilt down because that joint doesn't want to go in that way. And so then after you get the hip moving, then you squat more freely, which is not going to affect your back.
So are both of these workouts are good prior to squatting? Like, hey, do 5 on each side.
Yeah.
Loosen the hips up.
Yeah.
Go into your squat.
Yep.
Or deadlift.
Yeah. So I would say ideally, like that's a good action step. Like if you are tight or your hip has a tendency to be tight and doesn't want to open, because when like this motion is this when you're doing a squat, you know, it's that same motion. And so if it's tight, you don't want it to be tight, and you want to be able to challenge the muscles, not your mobility while you're trying to build strength. And so you want to have the mobility so that you can move freely, so that you can build strength. And so it just doesn't take long just to get things moving well. And then that way, when you are working out, then you're challenging the right muscles, not just like, oh, my hips don't want to move, I'm cheating in my back, I'm going to do it, I'm going to get stronger. But that way you're stacking strength on top of dysfunction instead of stacking strength on top of like function, like good function. So ideally you would have this, you're like, oh yeah, my hip doesn't want to open on the right. You could stretch it out, and then you probably you could do something like this, like a sideline, like little clamshell thing. Because this way now you're building strength right into that new range you just gained, and then go and do your workout. And that way it'll likely last and maintain instead of just being stuck. And I could I'll put this in a document and then share it with you guys within a day or so. But great warm up if you're tight. If you're not tight in that specific motion, don't waste your time. So like for you, I'd work on opening your hips. Inter-rotation was fine-ish. I think you're just naturally a little bit tighter person too. But I think that would be a great warm up for you. And then you just do your exercises from the hip. I think you also need to work on some thoracic mobility, but I'll show you how to test that right now. You ready, Amy? So this is a good test. So fun fact, everyone here wasn't here for the shoulder workshop, but if you're going to test the upper half of the mid-back, one easy way to see if you have a problem, because just like the mid-back can affect the low back, the mid-back can affect your shoulder and even the neck. And so one quick test is if you rotate your head to the left. So I have a tendency to be positive, and I need a manipulation on my right. So my left is pretty normal. My head's nice and straight. But then when I go to the right, I want to side bend this way. Can you see that? My head wants to tilt to the right. And then when I go this way, it's nice and normal. So that's the way to test the upper half of the back, which yes, that could affect your low back, but this test is better for testing like the lower half of the mid back. A little complicated, but just, you should have been to the shoulder workshop. But can you go on all fours? And then I want you to drop your hips to your heels. Good. So that just kind of locks out the low back. So we kind of theoretically take this out of it. And then I'm going to have you do one of these, drop this elbow down. And then I want you to open up as high as you can. So that's pretty solid. She doesn't need to work on that side at least. Can you test the other side? That's good too. Does that side feel a little tighter? Yeah, so that, I mean, I would say that's not the most positive thing I've ever seen. Probably not a huge deal, but if you were to work on one, it would be this. So that's a test and an exercise. That's why I just naturally had her drop. You don't have to drop. That's the exercise, is drop and open up, drop and open up. And then you just work on building that motion. Can you see it for a second? So this test you should have like about 60 degrees. Can you get in the same position?
We'll see.
Yeah, yeah. Oh yeah. Does it bother the knee at all or not really? Okay, cool. And you can see this extra muscular bulk too on his mid-back. That's protecting, I'm assuming, a joint somewhere in here. Just as a side note. But can you drop your elbow? Or you pick.
Okay.
Yeah, like this actually. Yeah. And then open up. Okay, test the other side. Both of them are pretty tight.
Sensing a theme.
Yeah, yeah. So that's the thing too, like the upper half for the shoulder, like me, it's more likely to be one-sided problems. The lower half of the mid-back, it's more likely to be both-sided problems. So for him, you literally just take that as an exercise. So go back down. Let's start with your right side. Drop this and go as far as you can. And then open up. And then exhale at the top. And then try and go a little further. Does that feel okay? And then back down. So ideally, if he was my client, I would, figure out which joint was the problem, doing like 2 tests on him, and then I would manipulate it and then do this so that it's more free. And see, it's already opening up a little bit more. This would be a great warm up for him, especially if he was going to be, I don't know if you run at all or anything like that. No, but running, even though you're going forwards, is a very much rotational thing. So if you have a hard time rotating at the hip or at the mid-back, because every step is all this. And so if this can't rotate, your low back is adjusting to that, or it's going to cause problems somewhere. If not now, in the future at some point. Sweet. Does that make sense? Yes?
When you do the manipulation and then you're able to move more freely.
Yeah.
In the moment, of the day.
Yeah.
Like, how do you get it to the point where you don't have to do that manipulation again? Is it processing or just, instant gratification and then
Well, that's one of the main differences between what I do and what most chiropractors do. I would say that most chiropractors, in general, the two different things that I do is that I don't just manipulate everything, because I don't know if you've seen the videos online, but they're like, crack the neck, crack the mid-back, crack the low back, crack the ankles, let's get the toes, let's get the fingers. And that's every single patient or anything I've ever seen. That's like most of the videos. For me, I would be like, oh, which joint is not moving? That's the problem. Let's just focus on that one. And then you didn't want to rotate to the right. Can you come up here real quick? So just sit on the table, please. And hug yourself. And then rotate. And then I'm going to drop this shoulder. So he doesn't want to do that at all. And then this way. Did it just click in there? Mm-hmm. Yeah. So likely the joint that just popped is already a joint that's moving too much and doesn't need a manipulation. Because if it's that easy, then it's truly not stuck. But so it was pretty hard to tell when he was on all fours and just rotating. But when I combine the motions of side bending and rotating, it's pretty obvious it's him going to his left. So hug yourself again. So going to the right and dropping this shoulder, it'll do it all day long. Going to the left, it's like, does it feel different to you? Or not really? Ugh, I guess they're both. Yeah. I don't know, actually. This is actually how I do it. Go like this. Does that feel okay? Somewhere right there, I think. And then relax your shoulders. Yeah, it's right right there. You can just feel different. There's a set of muscles on the side of the vertebrae that kind of get firm when they're trying to protect it. That's where it needs it. And so chiropractors just crack you and leave. And then there's no real resetting of like working on the motion that your brain was protecting. So a lot of times it's either from prolonged postures or some sort of trauma that happened way back when, you know, laying on your back, doing something goofy. Most of the time in the mid-back, it's from prolonged postures. Everyone sits too much these days. A lot of times in the low back, it's from some sort of trauma that happened, like deadlifting or squatting, moving a couch, anything. And then your brain protects that. So for him, I would work on both rotating and side bending after I manipulated it. So chiropractor just cracks and goes. I crack. Where did you not want to go? Where was your brain? Where did your brain not have that connection to move this way? Because really what the manipulation does, sorry, this is a long-winded answer, but what the manipulation does is it temporarily stimulates part of your brain called your periaqueductal gray. It's part of your midbrain that stores all of your movement patterns. And it's not truly, we're truly not affecting the joint in the mid-back. We're really just stimulating part of the brain to give it like, whoa, what just happened? It's just a quick motion. What just happened? And then your brain's like, oh, we can do this for a second? We can do this for a couple hours? Like, let's train that so that it doesn't come back. Typically what I see is after I do a manipulation, I teach people about better posture afterwards. I teach them how to use that new motion that we just gained. It typically sometimes doesn't come back, like with the Haley Ann. It never came back for her. But the other girl, I didn't need to manipulate her, but typically it's either once, I would say most of the time it's like twice after you reset it. There's one for the headaches that I do a lot of times, and that one's like 2 or 3 times typically. But there's different, our last little point about it, but there's different types of manipulations as well. So like that joint that did want to go when I went like this and it cracked, that's moving a joint by gapping it in general. For the most part, besides the mid-back ones that I do, because the joints are supposed to move like this, gliding. So when you move your head like this, they glide. So like this. All of the chiropractic manipulations, for the most part, especially in the neck, they're all gapping. The ones I do are all moving the joint in the direction that they want to go. So it forces the motion that your brain's protecting, and then we use that motion so it doesn't come back. Sorry, that was a lot of words. It is different, but the big thing is combining manipulation with exercise. And that's a big piece that PTs don't a lot of times have, and that's a big piece that chiropractors don't a lot of times have. I'm a big believer in you shouldn't choose chiropractors or PTs. You should choose not the profession, but the provider. And I'm sure there's great chiropractors here. I haven't met them yet. Anyways, so that one makes sense? Dropping this, opening up as a test and an exercise. Let's just do that one real quick as a test and see if there's one side that's like really stuck. And then you can work on it for like 2 minutes. How's that sound? Pretty good? Cool. You're so respectful, Brian. Yeah. Drop your, the important part is dropping your hips to your heels.
Yeah, because I was watching.
Yeah.
I was kind of lining your back up with the box behind you, so I had a midline, and I was watching how my
That was not quite as far,
No,
but
it's not.
but
Let
you
me
but you
drop
weren't all the way
my
back,
hips
yeah.
down.
So that one's tight. They're going to the right. Oh wait, maybe not. You just didn't try so hard.
Yeah, that one's definitely higher.
Yeah, do the left again. Yeah, that looks good. I think you're good there.
What was that?
left one just
Look normal. Did it feel the same on both sides?
It did. This side feels tight.
Can You want to go? Can you turn your head to the left? And then to the right. Do the left again. Yeah. See the side bending?
Am I bending?
Yeah. You want me to take a picture for you? All right. Yeah, to the right you go full.
Yeah.
And then to the left you stop early and side bend.
Oh, wow.
So that test is, like I said, like lower from here down for the most part. And then the rotating the head is a test for a little bit higher. So your left, you ever have any left-sided shoulder problems?
Yes.
Yeah.
Well, I just recently had, like, for like 4 months, like it was tight right through here. But I went out of town last week, stayed at the Westin in Seattle, and it went away by Wednesday that last week. And so I bought their pillow.
Oh.
And so I changed the pillow. The pillow came 2 days ago, and it's still like, I don't have it. When I started working out with Laurel,
Yeah.
I had this pain.
Yeah.
It was constant. But it's like, and I think it's my pillow. But
Yeah.
it's slowly loosening up, maybe, like
Well-
supporting my neck better, maybe at night.
Yeah. I mean, I would say in general, like, just because you don't have symptoms doesn't mean there's not a problem.
Yeah.
Because your symptoms can come and go,
It's probably still there.
but your emotion problem is still there right now in your upper back.
Like, I do a lot of like neck, like
Yeah.
trying to stretch, because I work, at my desk,
Yeah.
and as you start to, I
Yeah.
don't know, get tight and stress and.
Yeah. It's like that same idea though. Like, you can do exercises, which I'm all for exercises, obviously. I do it all day. But the thing that you need is the manipulation and then exercises to the left. And then work on.
Fix my brain.
This is what I do.
Fix my brain.
Yeah. Literally.
That's what I need prepared on.
Yeah, literally for you, I would manipulate your upper back, and then this one exercise is just like this. You raise your arm up and then rotate your head, and the joints are all trying to close. But if you did it without the manipulation, you're going to cheat in all the joints above and below it. So, can you do the test real quick? I'm curious. Oh wait, we already did it. Never mind, Jerry. Were you guys tight at all on one side?
A little bit, yeah.
I knew you were tight. I already tested you on that same thing, I think.
You did.
Yeah.
When I first got here.
Yeah. Cool. So, I mean, I think you can temporarily gain some mobility without a manipulation. I would just work on that, just rotating specifically, because I remember when you just did this, and you're probably still rotating the same amount, but that's all the low back as well. But then if you drop your hips to your heels, and then you rotate, that takes the low back out of it, and then it'll show a true joint restriction in your mid back. So, cool. How's everyone doing? Sweet. All right. And then I wanted to teach people just real fast how to utilize their core. A lot of times, especially with lifting, I think, the key is to put your ribs in a good position. That's one of the things I actually did with Mary, is she wanted to work on her squat because she was having pain like this, and this is how she was squatting. Maybe it doesn't look that abnormal, but then I was like, oh, have you ever heard of like stacking your ribs, and you just, boom, ribs right on top of your pelvis, and it actually helps you utilize bracing your core. And so this is called like an open scissor fault, because your ribs are like this, back slightly extended. It's really hard to brace your core like this and provide enough stability. So it's something that probably maybe is good for you. I don't know. But stack the ribs and then take a breath and brace your core as if someone's going to punch you. And think about taking a breath to where you push your hands out laterally. So it's like this. A lot of times people brace by sucking in, but pushing out laterally, keeping your ribs in this position, and then maintaining that throughout the lift. So especially squatting and deadlifting, especially a heavy deadlift or a squat, people would want to come up like this out of it. I had somebody the other day that was like, yeah, I just can't go down that far. And she was like squatting like this and then back up. And I was like, oh, don't be afraid to bring your chest forwards. And then she's like, wow. And I was like, there you go. Sometimes it's that simple, but like, I think those are two really big cues that I use to for someone who had back pain or other things going on is just stack your ribs. So right now mine are facing like through here. I want them right on top of your pelvis. And then brace before you did a lift. So trying to push out laterally. And then taking a little breath, holding it. And then it's like a good analogy is like act like you're going underwater. So like breathe up here. And then come up and breathe out when you're, so hold your breath while you're under the water. And then exhale when you're above the water. Does that make sense? Because you don't want to breathe underwater. So do those kind of make sense? Is anyone having a hard time like putting your hands here and then push? Yeah, push it out.
I totally see the stacking and how that would help.
Oh yeah. Sometimes it's honestly, a lot of the things with therapy or just like getting people better, it's like really simple things that you just do well. And it makes a world of difference. So sweet. Those are like the three main things. It can get really complicated, but especially like with a group of people, I felt like looking above at the mid back, looking below at the hips, and then looking directly at the core can kind of cover a wide spectrum of things. It does get more specific, and that's obviously when people get the most, like, gets the most improvement is when it's like, oh yeah, that knee can't straighten. Let's work on that knee. Those hips don't want to open. Let's work on that hip. Let's work on that mid back. A lot of times too, you probably have a low back specific spot that doesn't want to, if it was a disc, that doesn't want to close. And I'd work on that as well. And then make sure that whatever did bother you, deadlifting, squatting, any of those things. So it's like head to toe. I'd probably, like for you, if you did have low back problems, I would look at your neck or your upper back, because a lot of times your body tells a story. That's how I look at it. I would say another thing that I do differently is I very much look at the whole body, because if someone comes to me for their low back and then like, oh yeah, I also have a shoulder thing, but it's not the end of the world. I'm like, oh, let's look at that. And I'm like, oh, your upper back doesn't want to move, even though it feels unrelated. Every time, like, your brain doesn't like when you side bend all day when you're trying to turn your head. Like, let's fix that and your low back and your hips. Otherwise, it's going to show up as a knee problem in 6 months. And then you'll think I'm a great therapist because I helped you before, but really, I should have fixed all of it at the beginning. Because that's my goal, is to make people better so they don't need me and they tell their friends, not so that I see them for the rest of their life. So today only, I'm doing a workshop special where if you signed up for an evaluation and it was scheduled within the next 2 weeks, I'll give you $100 off. Or if you signed up for that and you decided to buy a package at that initial evaluation, then I'd give you a session for free. And if you have any questions about that, I'm super open about talking about it. And I'd love to help you. And I think you'd be in great hands. And based off of everything I've seen today, it seems like everybody could benefit. I think everyone needs therapy, even if it's just like a session or two to point people in the right direction. But I know I need it. And then, does anyone have any more specific questions about themselves or how their body is moving, or any other questions about back pain in general? Yes.
I would say, how long, maybe you mentioned this earlier, but if someone had, let's say, like a full body, like reboot, they
Yeah.
had like a bunch of problems, how long would you expect for I assume you would do manipulations, retrain the muscle groups, and then strengthen them? How long does that take?
So I do packages, and there's like, I have a 3-session package. If it's truly like a full body thing, that might be tough. I just gave somebody that one the other day. So basically how it works is I'll like see somebody and I'll be like, they'll tell me their story, they'll tell me their goals. And I'm like, all right, this is and then I'll do my assessment. I'm like, this, and this. I think it'll take 3 sessions. And I'm very upfront, and like, I don't want people to stay longer than they have to. And so if it's just a couple things, like one problem, sometimes it's 3, sometimes it's 5. It really depends on how old you are, how long you've had the problem, what is the problem. In general, if it's more of a stability issue, it takes a lot longer than if it's just a mobility issue. Like, it's very, very easy to get a joint moving. It's very, very hard to stabilize. But most of the time it's both. Like, you could manipulate the mid back, but then we still need to work on stability in the low back. But so in general, it takes, like, I'd say on average about, if you're having a lot of pain, 2 to 3 sessions to get out of pain. I would say 2 to 3 sessions-ish to work on some strengthening, and then 2 to 3 sessions-ish to work on performance. So like the exact thing that you want to get back to doing. But there's a spectrum. I do 3 session packages, 5, 8, 10, and 15. No one's ever gotten the 10 or 15 yet because I haven't found issues that were going to take that long. Does that answer your question? But in general, if it's just like a pain, you've had this thing going on for a while, and it's 15 years or like 4 years, I would say the first story I told about Haley, 10 years, and she saw me and for 1 hour, and all these other people have, tried to help her, and I'm the only one that like helped her in one session on my living room floor. That's kind of like a miracle story. Doesn't happen very often. Sometimes I'd say most of the time it's like 3 to 8. My most popular package so far has been 5. But I'm really not in it to like be like, stay here forever. I'm like, I find it as a challenge to say, how fast can I get you back to 100%? And I get a lot of fun out of it. So anyways, does anyone else have any other questions? If you have like something more specific you want to ask me, I really enjoy like nerding out and helping people. So yeah. And then if you did want to schedule for the evaluation, there's a QR code right there. And for most of you, I have like your contact information, and I'll reach back out, and I have the link there as well if you wanted to.
Are the prices listed?
They're not. We can talk about it though if you want. Yeah. Cool. Well, thank you so much for coming to the low back pain workshop, and it was a ton of fun. Have a muffin. Yeah.